Hello, this is my video assignment for Unit 3 in PU 500. My name is John Medina. This is my mother, Suzanne Medina. And I'm first going to go ahead and start with giving a brief explanation of what public health is. To me, public health serves as, it serves core functions, really, is what we've learned, the three core functions of assessing, policy development, and assurance, and really assessing, developing solutions, and taking actions against public health issues within communities on various scales that fluctuate. It could be within your neighborhood, it could be within your school district, it can be nationwide if you want it to. So that is my brief explanation of sort of what public health is to me. Now we're going to go ahead and debate the statement, health services and behavior are the only determinants of public health. What do you think about that?
No, I think there's other services that provide public health benefits.
Yeah, like what? Determinants, not services.
I don't know.
I'll go ahead and tell you. So it's a really misconceived statement that, your behavior and the health services available to you are the only things that determine your health. But there are other things as well. We can go ahead and start with behaviors and talk about diet, physical activity, hand washing, seat belts, alcohol and tobacco use. Those are all behavioral factors that, in a way, affect your public health. But then you go on to other spheres like biology and genetics. You have to take into account things like age, sex, inherited conditions, and, family of history of things like heart disease, stroke, diabetes, and things along those nature. From then you go into the sphere of social and physical determinants. And that's, sort of meeting your daily needs, accepting what social norms are within your community, exposure to violence, school quality, transportation. And then you get into your actual physical sphere, which is the natural environment, access to clean air, clean water, housing, barriers, work sites, how healthy they are, and things along that. And then you move on to health services. And when you're assessing health services, you really have to evaluate both the quality and the access. Does everyone have access to healthcare services? And if they do, how good is it in their community? Can it be better? What do you think?
Yes, I think we could have better healthcare services.
What are some steps you would take to get those better services?
Well, we live in Central California, which has many rural areas that people don't really have access to cars and to be able to drive into big cities to seek healthcare services. I do know we have some mobile services, vans and stuff that go out and try and help our rural communities, but I think we are far understaffed in that area.
And that really leads to the last sphere of things, determinants that affect public health, and that's going to be policy. That's sort of the taking action within the public health sphere. That's, using things like laws and regulation that influences our behaviors, our social norms, and our actual physical environment. So with those, components taken into account, those can all really have determinants on the quality of your health care, your health in your community, and things like that. So it really is just a lot more than behavior and services available. There are other things such as genetics, social, physical, and things outside of those realms that really can affect you as well. What are you concluding from this discussion?
I believe that when we talk about health, we need to look at a wider range of things. Some of the points that you brought up I never really thought about, such as living in a healthy environment and behavioral issues. I do know genetics does play a part of it, but I think we need to educate people better about exactly what public health is, and definitely work on our laws and hopefully keep our health care for everyone. In the United States, I know in Europe, they definitely provide healthcare services for all their people, and I think that's something that we definitely need to work on here in the United States. And we've taken steps towards it, but then they want to get taken away. So hopefully we'll be able to keep those laws in effect and maybe make them better. I know they're not perfect, and I know they need to be worked on, but make them better than they are today.
Awesome. Thanks for tuning in. Bye.